Set to discontinue the president's emergency plan for AIDS relief in South Africa, following South Africa's failure to make demonstrable progress on policy requests by the administration. In an email statement, the U.S. State Department says it has decided to initiate a phased drawdown, as PEPFAR was never intended to be permanent, and that South Africa is a middle-income country and is more than capable of supporting its own health programs. For more on this, Zeenat Abdool, UNAIDS Communication and Advocacy Officer at UNAIDS South Africa, joins us on the line. Zeenat, good afternoon, and thank you for joining us on Africa Update.
Good afternoon. Thank you, Lily, for having me on your show.
Zeenat, for interest's sake, just going through this, and one of the reasons that the U.S. has decided to part ways and to stop sending aid in terms of PEPFAR, they're saying South Africa is a middle-income country and is more than able of supporting its own health programs. What's your take on this reasoning?
So I think, importantly, what you've said and indicated that there is an announcement to reduce or to withdraw funding for HIV in South Africa. This is something that we have been dealing with governments across the world as well as UNAIDS. We've been talking about it for the past year, at least over the year, from the announcement that was actually made last year, January. And we must acknowledge that indeed there has been impact and there will continue to be impact. Coming directly to your question, and for contextual purposes, let's highlight that South Africa has about 8 million people living with HIV, the most in the world. PEPFAR was providing over $400 million a year to South Africa, and also salaries of about 15,000 health workers, representing up to about 17% of South Africa's HIV funding. Now, that is 17%, and government has also reiterated and continues to reiterate that approximately the rest of that funding, about 70% of that funding, is domestically funded. In fact, South Africa procures its own ARVs, and we're looking at that sort of impact mostly in the salaries of health workers and in the clinics that were funded by PEPFAR specifically for vulnerable and key populations. And so,
Zeenat, I have to ask you, we need to call you again on a different line or a different connection, because you're sounding so muffled and we're missing out on just the key points that you are making. Let's try a different line, and Mabu is going to give you a call shortly. It is 12:46 Central African time, and we're coming to you live from Johannesburg in South Africa. We're speaking to Zeenat Abdool, UNAIDS Communication and Advocacy Officer at UNAIDS South Africa.
Channel Africa is evolving, and so are you. Stay connected wherever you are with our brand new website and mobile app. Stream your favorite shows, catch up on African news, culture, and conversations, all at your fingertips.
Africa is just a tap away.
Your world, your stories, now on the go.
Stay connected wherever you are.
Visit channelafrica.co.za or download the Channel Africa app today. Channel Africa, the African perspective. Africa Update with Lulu Kabu.
Zeenat, you're back on the line with us. I hope it's going to be a lot better. Now, you were going through some of the whole year in terms of this being stated that the aid relief is going to end, and now we're basically at that point. And my question to you was, is South Africa going to be able to carry this? Yes, it was 17% of the aid coming from the U.S. under PEPFAR, but now what now?
So basically, I mean, it's not only South Africa that's impacted by the funding withdrawal from PEPFAR. And of course, this has been a topic of discussion at the high-level meeting that was currently underway over the past 2 days in New York, which brought through 193 member states to develop a political declaration on the way forward. And it must be emphasized that this political declaration, or this high-level meeting rather, on HIV only happens once every 5 years. And as our executive director, Winnie Banzima, had said in that briefing yesterday, she said, please do not take money away because you are taking lives away. There must be a planned transition. And she's also added that, we are seeing early signs of serious reversals in our progress. And of course, she was referring to globally, not just in South Africa, but the trend has been going down. The number of HIV infections, the number of people dying from HIV-related causes, and now is the time where we may now reverse, the gains that we've made, and it may start rising. Specifically for South Africa, we've also been monitoring the situation on the ground. We have a very close relationship with government and partners, and the impact on the ground has already been documented. The halting funding has led to the closure of many clinics where vulnerable and key populations were accessing treatment, and a significant reduction in services such as HIV testing, care, and treatment. However, the government has reiterated that the public health facilities remain open for all who are seeking treatment, including those that were visiting the other clinics. So when we talk about key populations, we're talking about adolescent girls, young women, and pregnant women who are at risk of losing access to critical HIV prevention tools such as PrEP. But there's also been disruptions, of course, in data management, in mobile clinics, and drop-in centers. And also we've seen that, the halt in the U.S. government support has led to a pause in the Richite community-led monitoring project. Now, you would remember that Richite is, as mentioned, the community-led monitoring project, which monitored more than 400 public clinics and community healthcare centers, which were located in 27 priority districts across 8 provinces of South Africa. And these are facilities covering nearly half of all people living with HIV on treatment in the country. You asked, how does this funding impact? What's the plan forward? I mean, Richite and in communication that we've had with them, yes, they've reduced the program, but the program has not completely fallen away. And we have seen that despite these funding cuts, government has made a concerted effort to continue the progress that has been made. Last year, government launched the Close the Gap campaign aimed at ensuring that more than 1.1 million people could adhere to HIV treatment. We've seen them also launch the rollout of lenacapavir earlier this month, if I'm not mistaken. Yes, on the 1st of June, in Secunda and in Mpumalanga, aiming to reach almost 400,000 people, 400,000, prioritizing key populations, especially adolescent girls and young women. I think it's been, one of the key topics again at the HLM, the high-level meeting on HIV, has been, governments finding ways to domestically fund the HIV response.
And, in terms of the number of job losses, what is the country looking at? With the impact of the different NGOs that have been doing the work on the ground and experiencing what young people, as you mentioned, and just the 8 million people who are living with HIV. These are the confirmed ones. That group of employees. What's happened to them, and what is the? Are they able to find different employment in different areas?
So, look, I mean, at this point, the ESC community health workers have been affected, and we know that community health workers are literally, I would not, perhaps it would say the intermediaries, they are part of the community, they are trusted as a source of information, they are able to connect with people and ensure that they adhere to treatment. And so we have seen job losses in that particular sector. We have seen those community health workers, having lost their jobs. And what UNAIDS has itself called for is we've called on the private sector to step in. Our UNAIDS regional director, Africa and for Eastern and Southern Africa, Ms. Anki Fukushongwe, has called on the private sector in South Africa to help bridge the 17% funding gap and propose the creation of a South African Solidarity Fund against HIV, similar to what we had seen set up during the COVID-19 response. We are seeing that government have recognized the importance of community healthcare workers, and that, they are working on a plan to ensure that the HIV response does not reverse, and the gains that have been made are not reversed by trying to find alternative means to keep these community healthcare workers going.
We have run out of time. Thank you so much for joining us on Africa Update.
Thank you so much, Lulu. Thank you. Have a wonderful day.
It's been a pleasure. That's Zeenat Abdool, UNAIDS Communication and Advocacy Officer at UNAIDS South Africa, joining us on the line.
Africa Update.